And welcome to the Dr. Bob Show. I think it's a fair thing to say everybody is interested in their health. They want to stay healthy, they want to be healthy. They wonder if something's going on that they should see the doctor about, or they wonder if their doctor has some advice about the future where their health will be better. My guest is Dr. Rebecca Jackson. Dr. Jackson is a board-certified internal medicine doctor, and she answers the questions of how to stay healthy and how to stay happy every single day in her practice. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes in the Dr. Bob Show, and I hope at the end of the show you and I both learn a little bit more about staying healthier and staying happier. We're talking with Dr. Rebecca Jackson, board-certified internal medicine specialist, and we're going to be talking about how to stay healthy at different age groups. We all get older every day, the last time I thought about it, and the chances of getting an illness as we age becomes more prominent. Rebecca, welcome to the Dr. Bob Show.
Thank you for having me back.
Well, it's always great having you as a guest because you do such a great job. The last one we did was on the thyroid, and I thought you were magnificent.
Thank you.
Tell me, when does a patient need to see an internal medicine specialist?
Once they've graduated from the pediatrician, which can be at the age of 21 when the pediatrician pretty much kicks them out, or it can be when they're just more comfortable going to an adult doctor.
Yeah, and so it's different for different people, but somewhere around 18 to 20, somewhere in there, are when the patient agrees with the pediatrician.
That's correct.
When you see a young person come in, 18 to 20, what are you thinking about as far as getting that patient healthy and keeping them healthy, and what they should be doing to stay healthy?
So that's the physical exam. And I love doing physical exams on patients. That's my opportunity to sit one-on-one with the patient and see how healthy they are, and if they've gotten some unhealthy habits, we can get them back online. So it's that one-on-one opportunity to see, are they leading a healthy lifestyle? Are they up to date on their immunizations? Are they getting their screenings done? Are they getting the lab work that I need that makes me think, yes, you're healthy, or no, we've got some issues? So that's what I really like to do.
So as you're doing that initial physical exam,
yes.
Is there a certain part of it that's any more important, like the blood pressure, or about listening to the heart, or listening to the lungs, or looking in the eyes, or looking at the throat, or having them say, ah?
You know, it's all important, but the most important is the history. I would say talking with the patient gives me more information than what I glean from the physical exam. Although the physical exam is important. I'd say the physical exam is about 10%, and the history is about 90%.
I used to have a professor that used to say, that's all like the hand. The most important digit is the thumb. That's the history. Then you come to the physical and the lab and the other things. I think that's so true. Yeah. You learn a patient's health by what you ask them and what they tell you.
Right.
If somebody's 20 and they say, I'm healthy, I'm ready to get married, what do you think of on the physical, and on what questions you ask 20-year-old female?
20-year-old female, we might start to talk about a pelvic exam. We usually start the pap smears at age 21. So we now know that cervical cancer, which is one of the things we screen for with women in their 20s, is caused by the human papillomavirus. Now that's a mouthful. We'll call it HPV, yes. So HPV causes cervical cancer. It's sexually transmitted. So that's one of the things we're going to start to think about as they age from 20 to 21. We'll want to get that pap smear. With most pap smears these days, we also test for the HPV virus. So if they don't have the virus, we can wait another 3 years and then test them again in 3 years. And as the woman gets older, into her 40s, 50s, stable relationship, we can test every 5 years, as long as they're HPV negative. And there's also a vaccine out that young women and young men are now getting to prevent HPV. So I think in the future, HPV will be very less common.
You know, vaccinations are becoming so important in keeping people healthy in medicine. Do you have a checklist on certain ages and certain vaccinations that a person should have?
We do. We absolutely do.
And it's, is it difficult for a patient to keep those records if this is the first time they've seen you and it's been 10 years since they saw a doctor? Do they know what their vaccination record is?
We try to get those records from the pediatrician, but now it's all logged on a central system for the Tennessee Department of Health. So it's actually easy to get all those records.
When you're satisfied that the physical exam is okay and that the vaccinations are okay and the patient's history to you is acceptable, what do you advise somebody that's 20? Now, we want to keep you healthy the next time when you come back here. Here's what I want you to do. What do you tell that person?
This is my most favorite question. I'm so glad you asked this. So there are 5 pillars of health. The first is exercise, all right? 20, 30 minutes every day, you know, if they can. 150 minutes a week is ideal. So, you know, if you can only work in 4 or 3 days, try to get that 150 minutes in. And it can just be walking. It's the kind of exercise where you are getting just a little bit winded. Not a slow walk, but just a walk where you might, if you're talking to someone, you might have to breathe a little bit more deeply to keep the conversation going. But walking is fine. If you want to jog or do something else, that's great as well. Exercise. Diet. Oh gosh, diet is so important.
When somebody comes to your office and you're thinking about exercise and then you're thinking about nutrition or diet, why do you consider that so important?
Well, we are what we eat.
Yeah, that's right.
For the diet, I try to have my patients focus on things that grow from the ground.
Plant-based diet.
Vegetables, fruit, whole grains, legumes, those things are so healthy for us. Things that come in the world with a barcode, not so much.
And the French fries and the fatty red meats and the things that we know are not really good for our health.
Right.
How do you tell people to stay away from those?
Well, I make them think about it. So for example, I ask them, what does a cow do? When you see a cow, what's it's doing? It's doing one of 2 things. It's either eating or it's lying down. That's it. It's one of the 2 options, and that's all they do. So they have more fat in their meat. But when you see a free-range chicken or you see a wild turkey, you know, they're running around doing stuff. Fish are swimming, right? So those are going to be your protein options that have less fat.
So you got to have protein. You could have other kinds of protein other than meat.
Absolutely.
Beans, certain types of other foods.
Tofu, vegetables. There are a lot of vegetables that are high in protein. Broccoli and asparagus and Brussels sprouts. There are all kinds of great vegetables.
You're making me hungry. Is there a weight goal that you set for people? If you've got a person you've talked with, they've got their weight recorded, do you look at the weight and see what their body mass index is?
I do, every time. And I watch the trend as well, because trends are important. I try to keep it between 20 and 25.
Okay, and so that would mean somebody is in pretty good shape.
Right.
And you tell them to bring, if it's too high, you tell them they're going to have to do what?
Work on that diet and exercise.
Yeah, and
right?
those are critical. There were 5 pillars.
Okay, number 3, sleep. Sleep is so important. That's how we regenerate our brain cells. That's how we recover. So sleeping, ideal 7 to 8 hours is what I'd like my patients to get. So I encourage them to get 7 to 8 hours. So we're the only species on the planet that tries to rob ourselves of sleep. You know, stay up late watching movies, and then you got to get up early.
And everything that I've read in medical literature says that people are really sleep deprived. They don't sleep well.
So important.
So sleep 7 to 8 hours. Everyone's a little different.
Number 4 is connecting with people. It is very important to connect. The worst form of punishment is isolation, solitary confinement. It's terrible. We need each other. We need to communicate with one another. And this past couple of years with the pandemic has been rough on a lot of people.
It really has, and it's been rough mentally. I'm going to jump to number 5. What is it?
Number 5 is, you want to guess?
Well, you've got social laughter.
Well, that's a good one. That should be number 6. But it's mindfulness, meditation. It's that time when you disconnect from social media, you turn your computer off, and you're just sort of in the moment. So mindfulness, yoga, meditation, prayer, bubble bath, where you're just watching the bubbles pop.
Oh, wouldn't
right?
that be fun?
Watching the birds, but you're just watching the birds. You're not thinking about that email or that Facebook post. You're just in the moment.
I watch my hummingbirds.
Perfect.
And I love
Yes.
to sit in a chair and just watch how mean they are to each other. As we get older, 30 to 40, are there different things you look at?
Yes.
Are those 5 levels still important?
Those 5 things are always important for long term.
And that's what we're going to be talking about. Well, what happens when we get to be 30, which is older than 20, or 40, when you finally hit the 40? What does the doctor look for, and how does the advice change, and what can the doctor do to keep you healthy? We're talking with Dr. Rebecca Jackson, board-certified internal medicine specialist, and we're talking about guidance on how to stay healthy at all ages of life. We started off with a 20-year-old female, and we went through 5 different stages or topics to keep that person healthy. Our 20-year-old is now 50.
Okay.
She hasn't seen you in 10 years.
Oops.
And she's getting a little aches and little pains and a little bit worried about her health and not worried, and she's a little bit worried about how she's thinking. How do you approach the 50-year-old?
At 50, things start to happen.
Yeah, they
So
do.
we have to take up those issues. And like I said earlier, we have to focus on the lifestyle habits, but also what comes into play at 50 are some cancer screenings and some other screenings that we can talk about. Mammograms usually start at age 40, but for sure we make sure they get them at age 50.
If they get one at age 40 or 50, first time, how often do they repeat it?
Every year.
So yearly mammogram.
Yearly mammogram.
What does the mammogram tell you? What are you looking for?
Looking for changes in the breast that may signal breast cancer. Early changes that you would not be able to feel on physical exam.
So if you find a suspicious mammogram that is suspicious for cancer, do you think about, you've got the breast that you're worried about, and you get further studies for that. What about the ovaries?
The ovaries start to not work so well at 50. The average age of menopause is 50, 52. So as that estrogen and progesterone levels start to go down, especially the estrogen level, women become symptomatic, which means that their sleep may be disrupted because of hot flashes, night sweats, sometimes the moodiness. I mean, it can cause a whole host of symptoms, and everyone's different. Some people sail through menopause without any symptoms, which is wonderful. But that estrogen loss makes us worry about what's happening to the bones, because the bones need estrogen in order to stay healthy.
So if you're suspecting or you have to check, how do you check the bone health?
We do a bone density. And
What's a bone density?
It's a quick little x-ray. We do the hips, because that's often a place where people will fall and break, and the spine. We look at those 2 weight-bearing areas and we see how much calcium is in the bone. And at 50, it's usually not too bad. It's a baseline. But if it looks a little bit low, we may repeat that test in 2 years. If it's fantastic, we may do it every 5 years.
And what you're looking for is loss of bone?
That's correct.
And if you see loss of bone, what do you do about it? What can you do to put calcium back in bones?
Well, a number of things that we can do, which is a whole other topic, but that might be an issue where if a woman was having a lot of symptoms, postmenopausal or menopausal symptoms, hot flashes, night sweats, and you're on the fence about should we do hormone therapy because she's miserable, that might be the thing that throws us over to getting hormone therapy. It's kind of a risk-benefit sort of thing. Calcium, vitamin D, weight-bearing exercises are so important in helping maintain bone.
What is a weight-bearing exercise?
So it's the ones where you're basically putting weight on your extremities.
Yes, sir.
Swimming is not weight-bearing.
That's
So
right.
for example, walking, jogging, the ellipticals to a certain extent.
Lifting weights?
Weights are wonderful, yes.
So they'll help the body say, oh, you need to put a little bit of calcium in there, and that will help correct osteoporosis.
Yes.
Do you see the results on a bone scan if somebody is good on their program and they come back 2 years later and you've repeated the bone scan?
Oh, it's fantastic. To see bone growth, yes.
Yeah,
It is wonderful.
And what that tells the patient is they have less chance of breaking a bone.
That's correct.
What else do we think of at age 50?
Colonoscopy.
Colonoscopy. Everybody loves that, the thought of a colonoscopy. And it really, I asked a patient one time, what was your colonoscopy like? And they said, like a 45-minute nap. So what does the colonoscopy tell you, and why is it so important?
It will pick up polyps that may turn cancerous. So it's an early detection for screening of colon cancer. And it's an easy test itself. It's the preparation for it that's the hard part.
Yeah, and that's what everybody complains
You find
about.
a polyp, you smear it, you take it out, and you avoid cancer. So that's what we want to do. If someone has a lot of polyps, it may be a sign that they are more prone to colon cancer, so we might screen them more frequently.
And if their history says there was some early colon cancer, you may start the colonoscopy at what age?
10 years before their first degree relative had their cancer.
Yeah, and so how important is family history?
It is important, very important.
I think as we are now living longer, we're dying of the things our parents died of, and therefore it's extremely important. Okay, so we've got breast prevention of cancer, we've got colon prevention of cancer, we've got bone density, keep from getting chances of getting a fracture.
And we have immunizations. So there are some immunizations that you can start at age 50. Sometimes it depends on if insurance pays for it. Shingles is one of them, and pneumonia is another one.
So the pneumonia, shingles, maybe COVID.
Right.
Is that a difficult thing, talking to people about whether or not they should get the vaccination if they're resistant to it?
It can be a difficult conversation, but I try to give them information and so they can make their own informed decision.
Flu shot?
Flu shots every year.
Meningitis shots, liver shots, hepatitis?
The meningitis shots are usually done before college.
At age 50, some people begin to have trouble with digestion, and their B12, vitamin B12. I used not to think much about that. It causes a special anemia, but now it's important because we're living older and sometimes we need B12. Do you measure that?
I do, especially someone who's had fatigue or if their blood count. Now, what we also do with the physical exam is we do a blood panel. And what that blood panel looks at is cells. And sometimes we can tell by the size of the cell if there could be a nutritional deficiency. So red cells will often be a little bit large if there's a B12 deficiency, and then I'll go back and I'll add that B12 on there. They don't even have to come back for the blood work.
Any other lab work that's important? How about blood sugar?
Yes. Blood sugar is very important. So if someone's BMI is actually in an unhealthy high range,
so if they're
I
heavy,
might also check them for diabetes by looking at the hemoglobin A1C. So not just the immediate blood sugar, but what their average blood sugar is over a 3-month period of time.
And your hemoglobin A1C will give you that measurement.
That gives us a 3-month idea of what the blood sugar's been doing.
So you're really doing a really good job with this person to make sure that they're not getting cancer, or the things that we can prevent or find early and treat. Be sure that we're doing everything about breaking bones, and that we've got our vaccination to protect us.
Right.
Anything else at age 50?
Cholesterol. Cholesterol is so important. Yes, we want to be sure that their cholesterol profile is such that they're not going to start developing plaque in the arteries of their carotids or the arteries around their heart.
So you have to start thinking about hardening of the arteries.
Yes.
And that will lead up to age 70. Are there things we look for at age 70?
There certainly are.
And that's what we're going to be talking about when we come back. Wow. There's a lot of things that the doctor needs to check to make sure that you are going to stay healthy as long as you can. We're talking with Dr. Rebecca Jackson, board-certified internal medicine specialist, and we're trying to stay healthy by looking at certain things we should do and certain tests that we should have to prevent getting diseases in the future. We started at age 20-ish and then we jumped right ahead to age 50-ish. Now we're 70. By this time, somebody's probably got some illnesses that are important, and every patient's different. You have to treat every patient differently. What if they've got heart problems, chest pain, and elevated cholesterol? What do you tell that patient to do?
Well, we want to focus on the healthy lifestyle that we've talked about before, eating healthy and the exercise, and focus them on taking their medicines appropriately. We want to be sure and check that cholesterol, make sure that cholesterol medicine is bringing their cholesterol down so that their heart disease doesn't get any worse.
Exercise, can you exercise when you've had a heart attack?
Absolutely, absolutely you can.
That helps bring the cholesterol to a proper level.
It does. It helps improve blood flow. It helps the blood pressure, which is also very important.
What does it do to the mind, exercise, running?
That actually improves blood flow and will help the mind, so it does help. It's one of the few things we know that helps prevent dementia.
So it helps prevent dementia, exercise does. I had a physician tell me on the Dr. Bob show one time it causes neuroneogenesis, meaning basically you develop new nerves in the brain because you're exercising, getting that blood flow. When do you begin to worry about if the patient tells you they're 72? And I can't remember as well people's names, where I ate last week, or something that's happened in the past. Is that abnormal, or you worry about it, or you have tests?
I don't worry about that in particular. And the fact that they brought it to my attention, that they could remember to tell me about it, is a good sign, right?
It is.
So nouns are very difficult sometimes. As we age, things slow down. So the words are still there, they just take a longer time to get to the tongue. And so I don't worry about that unless they're functional issues like I forgot to turn off the oven, I forgot to put the car in park. Those are worrisome.
The car, you forget where you parked it, that's okay. Not knowing that you had a car to get there is not okay.
That's correct.
Anything else that is a key to maintaining somebody's health at age 70-ish? How about mobility? How about core exercises?
That's fantastic. I'm glad you brought that up because I did want to talk about this. So the Medicare Wellness exam that...
Medicare Wellness.
Mm-hmm. We have staff that look at certain things that we watch for in elderly. For example, one of the key components is the get up and go test. And that's where you just stand up. She watches the patient stand up, walk across the room, and walk back.
What does that tell you?
Well, if they can just stand up and walk across the room and walk back, they're good.
Yeah.
But if they have to lean forward and push, then that tells you that their core is getting weak. And you may want to get some physical therapy.
Does physical therapy help those people?
It does. It helps tremendously. And if they're walking across the room, but they have difficulty turning around and coming back, their balance may be off, and we can get physical therapy for that as well. Or an assistance device if they feel like they're going to fall, if they're unstable.
When somebody's in their 70s, they have a chance of having hardening of the arteries and some thinking problems, and lots of things come into the total wellness package that we rely on the doctor to take care of.
Right.
So do you have to be smarter and smarter and smarter as somebody gets older and older and older?
No, you don't. One of the other things on the medical wellness exam is the clock draw test. So she gives them a piece of paper that's round and says draw a clock, and she may say make it 12:30. Put the numbers on the clock and make the hands at 12:30. And that tells a lot about fine motor skills. Do they remember the numbers? And if there's a problem intellectually, it'll often appear on the clock draw test.
So all the things that you've told us about are developing and accumulating information that allows you to try and correct the problems that you found on that patient.
Yes.
And those 5 core things are still the most important. What are they again?
Diet, exercise, sleep, connecting with people, being social, and taking a moment to just be in the present. Mindfulness.
Do people not spend enough time taking care of themselves?
Yes.
Yeah, and I think that frequently you got to remember how important it is to sit back and relax. And you and I were talking earlier about a bubble bath and just watching the little bubbles pop. That in itself is so soothing.
Yes.
Rebecca Jackson, you're a great teacher as always. Thank you for taking the time to tell us what we need to do to stay healthy. And I think an important thing is making sure that you see your doctor on a regular basis. Too often we say we just don't have enough time for that. Thank you for coming. I hope you come back and teach us more on the Dr. Bob Show.
Thank you very much.
Remember, you take the information that Dr. Jackson has given us, and remember the 4 things that we always say on the Dr. Bob Show. Number 1 is exercise. When you exercise, it will help get calcium on the bones. It'll make your heart healthier. You'll feel better. A runner's high, you have little areas in the brain that pop up, or little happy areas. So a runner's high will keep you happy. Eat what you eat is who you are. So be sure that you select the foods that will keep you healthy. 7.5 to 8 hours of sleep every day. Everybody needs a little bit different, but about 7 hours. And remember, on that 7 hours, be sure you're sleeping well. If you're not sleeping well, you have to talk that over with your doctor. There are so many problems that can keep people from sleeping well. If you're snoring, be sure that your snoring is not causing sleep apnea, where you actually stop breathing for a period of time. And most of all, on the Dr. Bob Show, we like that laughter in your life. And there's nothing better than sitting with Dr. Rebecca Jackson and laughing and smiling and talking about stories and medicine and things that make us happy and make us fun. So take time for that laughter and you'll stay healthier.